Welcome to Hyperion Behavioral Health Center's Employee Orientation. Our company name, pronounced Hyperion, comes from a redwood tree of the same name. Northern California is home to many giant redwoods, and among them is the Hyperion redwood, which is the tallest tree in the world. And these enormous trees thrive under really challenging conditions and are a wonderful symbol for those that we work with. And that's how we decided on our name, Hyperion Behavioral Health Center. Our guiding principles, which are also listed on our website, tells you a little bit about who we are and our general philosophy. We tailor treatment to fit the individual. We believe flexibility is an essential ingredient in all treatment programs. We need to bring psychological flexibility to our clients and families and model that behavior. And you'll hear a lot more about that during our clinical training. We work to improve the whole family, not just the individual we're working with. We believe behavior services should lead to an emotionally healthier and more satisfying life. We value compassion and kindness as integral components of all treatment models. We believe our business and clinical practices should align with our commitment to social responsibility. So a little bit more about who we are specifically. We have two co-founders, Dr. Ira Heilville and Sharon Venezio. You can look on our website and read our bios, HyperionCenter.com. Click on Our Founders. We have clinical supervisors, which are BCBAs or mid-tier supervisors who are in the process of preparing for the BCBA exam, and behavior therapists. You'll hear more about our biller and our administrative assistant during our clinical training. We offer diagnostic assessments, functional behavior assessments, behavior analytic services, primarily in the home, though we do provide services in a number of school districts. We also offer consultation and training, parent education. We are in the process of implementing our social skills program. We also offer psychological services. We work in Ventura County and Los Angeles County. We have an office in Glendale, and we have our headquarter office in Ojai. So we have staff serving clients in their home in the San Fernando Valley, East Los Angeles, Ventura, all the way up to Ojai, and we accept cases throughout the region. We work with a variety of funding sources. We are vendored with multiple regional centers. We accept a number of Medi-Cal providers, and we are in network with most commercial insurance companies. So a little bit about our staff roles. So each therapy program typically has a team of behavior therapists. If it's a small program, meaning there are less than 6 hours a week of therapy being provided, there may be only one behavior therapist placed on that case. But typically, if a program is 15 hours or more, so if there's a session every day, then likely there are 2 therapists to that team, and there is a clinical supervisor assigned to every case. The role of the behavior therapist is to provide direct therapeutic instruction, establishing a positive relationship with the families that we work with, providing support and representing Hyperion. So the behavior therapist implements the program as outlined by the clinical supervisor. The therapist does not modify or create that program. We want behavior therapists to understand the reason for the programs, the ultimate goal behind each program, and to understand the strategies that are being used for behavior reduction. And we welcome your creative input. Once that is discussed with the clinical supervisor, then your input will be considered, and we can incorporate that after a discussion happens. So we welcome your input, and the clinical supervisor will be the one to ultimately decide on the structure of that programming. And parents are also part of that team, so we welcome their input as well. You are also implementing a behavior intervention plan, which addresses behavior excesses. So there may be a behavior plan in place to reduce behaviors, and then there are programs that are in place that are teaching skills. Behavior therapists are also responsible for collecting data for within every session, recording responses to programming, recording behavior data. We will work through that during our clinical training. Behavior therapists are also responsible for documenting and signing session notes for each session, as well as rendering their session, and for communicating with the clinical supervisor. The role of the clinical supervisor is to conduct functional behavior assessments, create therapy goals and therapy programs to target skill acquisition. Additionally, clinical supervisors create behavior intervention plans to decrease behavior excesses. They write assessment reports and submit those to our funding sources. Clinical supervisors will analyze the data that the behavior therapists are recording within each session, and they will graph that data and share that with both our funding sources and our families. They will conduct team meetings on a case-by-case basis depending on funding. The clinical supervisors are a source of ongoing support for the behavior therapists. They will be in the field regularly, observing the behavior therapists conduct sessions, offering feedback, modeling new programs, working collaboratively, and ultimately moving the therapy program forward. Clinical supervisors also offer support to our parents and provide direct parent training. We encourage direct communication between the behavior therapists and the office. We want to have those established relationships. However, the clinical supervisor is in the field and will be an ongoing source of support for the direct staff. Parent responsibilities. Parents, caregivers, and other family members are an integral part of the treatment team, and their ongoing participation is welcomed, encouraged, and it's in fact necessary. Parent participation is an important factor in each child's progress, and it increases the likelihood of success. So the more a parent is involved, the better the outcome. So we encourage questions and communication. There must be someone over the age of 18 present at the home for all sessions. And that could be a parent, a babysitter, a respite care provider, anyone over the age of 18. Now let's take a look at Hyperion's policies and procedures. These are all outlined in more detail in the Employee Policy Handbook. Non-fraternization policy. Hyperion Behavioral Health Center strongly encourages maintaining professional boundaries with our clients, relatives of clients. Your position as a behavior therapist and as a clinical supervisor means that you are going into someone's home, and often for many hours each week and for possibly years. So it is easy for those boundaries to erode over time. It is your responsibility to ensure that those boundaries are maintained. If they are not, it very likely will impair objectivity, and it interferes with effectively performing your functions as an employee. It interferes with the outcome of the therapeutic process. And it is the client who ultimately suffers. So it is crucial to always enter each session with that in mind, and to remind yourself of your role. And the burden of maintaining those boundaries is on you, because you are the professional going into the home. If you are in a situation where that is challenging, reach out to us. We're here to support you. There are all kinds of situations that we walk into when we work in people's homes, and some of them are more challenging to navigate than others. And we are here to support you and help you through that process. So this policy is very important, and we are here to help you achieve it. So please reach out as needed. Mandated reporting. You are a mandated reporter if you suspect abuse. You will sign an acknowledgement form at the end of your orientation, and this is acknowledging that you are aware that if you suspect physical, mental, or emotional suffering has been inflicted on a client, you need to report that immediately to either Sharon Venezio or Ira Heilville. And incident reporting is also mandated. If there's an incident in which a client suffers an injury requiring medical attention, injures another individual, is named as a suspected perpetrator or victim in an official sexual harassment complaint, or has been involved in an activity requiring notification of law enforcement or emergency personnel, and even an incident in the home during session that results in bleeding or skin breaking or some kind of injury that will leave a mark, you need to report that. And we will then report that to the funding source within 48 hours. But you need to report that to us within 24 hours. And that is for your own benefit, to have that injury in writing and the circumstances in which it occurred. Professionalism. In our employee handbook, there is a larger list of behaviors which are prohibited, and you are encouraged to go and read through that and ask any questions that you may have. Some of these behaviors may seem like common sense, but everything that is in here because it has occurred in our experience. So we state each one. Transporting clients in your vehicle is prohibited under all circumstances. Driving a vehicle in which a client is present is prohibited under all circumstances. If there is an outing for a client that is discussed with the supervisor and the office, and it's agreed upon that there will be an outing in the community, the typical process is that you, as the behavior therapist, will meet the client in the designated location. It is prohibited to administer medication. It is prohibited to be alone in the home with the client. And even when a a caregiver is present in the home at all times during session, you should not be in a room with the door closed alone with the client. This is not meant to be an isolated type of therapy, so this therapy should be open where everyone in the home can hear what's going on, and the therapy is moving around from room to room. It's an active process. So there should always be a level of transparency and visibility. It is prohibited to use a cell phone for personal use during a session. It has come up many times that cell phones are often used as timers, so there's a therapeutic use to that. That does sometimes result in confusion and family members thinking that a therapist is in fact looking at their phone or texting while conducting therapy. So if a timer is needed, that's something that can be provided. So you do not need to use your personal cell phone or any cell phone for a timer. Eating a meal with the client or joining the client and client's family for mealtime is prohibited. That would be an example of violating professional boundaries. Leaving a session early without informing your supervisor. So there might be an emergency, something comes up, perhaps you start feeling ill. If you're doing a 2-hour session and halfway through you feel you need to leave, of course, if there's an emergency, then just let us know, let your supervisor or the office know, and we'll take it from there. Sleeping or loitering during working hours or near a client's home. This has occurred where someone had a gap of time and would arrive early and take a little nap before the next session. And we can't prohibit what you do when you are not on the clock, so to speak. However, a client would likely feel uncomfortable seeing their child's therapist sleeping outside. So if that is something that you wish to do, you keep in mind to park elsewhere and do that a little more privately. Smoking in the homes or on any school site is prohibited as well. So please read the additional policies in the handbook. Dress code and personal appearance. Please read the Employee Policy Handbook for specific dress code guidelines. There are hyperlinks throughout this PowerPoint. If you are watching this as a video, you will not be able to access those. However, you have been provided all of the documents during orientation. A professional appearance is important when you are representing yourself and Hyperion. Generally speaking, the first couple of sessions would be what one might call business casual. You want to represent yourself professionally. However, you are also engaging in activities that require mobility. And if you're working with a young child, you might be on the floor playing. So there needs to be a level of comfort and as well as safety. If you have a client who elopes and you need to be able to quickly run after that client, you need to be wearing shoes that allow you to do that without injuring yourself. So there are many variables to consider. So you should be dressed in a way that allows you to be comfortable and mobile. However, you also need to be professional and sensitive to all the different cultures that we encounter when we go into people's homes. There are specific guidelines for you in the policy handbook, and please ask any questions that you may have. Communication. Some general guidelines for communication, and we will talk more about this during our clinical training. As a behavior therapist and as a clinical supervisor, we do not provide your personal cell phone number to clients. This is another way to encourage professional boundaries and to protect you from phone calls in the evening, and the parent has the phone number of the office, and clinical supervisors are given a cell phone, so each family has the phone number of their clinical supervisor, and they have phone numbers of the co-founders, so there are multiple people they can reach out to, and we are there to support them. They do not, however, have the personal cell phone number of behavior therapists. Behavior therapists should direct all scheduling matters to the office. If a parent is asking you to move a session or to modify the schedule in any way, your answer is to direct them to the office. There are many, many variables that go into scheduling, and we have one common person doing that, so that person can account for all of those variables. We are often considering placing someone on other cases, and there's information that only the office would have when making decisions about altering times for sessions. So for everyone's benefit, that should be handled by the scheduler. Please notify the office immediately if a parent cancels a session upon your arrival. If you're canceling a session, please call the office with as much notice as possible. So if you have a session in the afternoon and you wake up feeling ill, you should call the office and let us know. Even if you're not quite sure if you're going to cancel that later session, you can give us a heads up and we can start to plan. That gives us time to find a sub and to let the parent know and to talk to the clinical supervisor who might be able to sub. So it gives us time to find an alternative solution. And check your Hyperion email daily. We use email to communicate. We have a staff who are mobile, who are driving, who are in sessions. So we are often using text and email as our main form of communication. So please ensure that you check your email daily. We can help you set that up so it goes to your phone if that's easier for you. Either way, at some point, whether it's find a time that works, whether it's in the morning or the evening, as long as you are checking that every day and getting back to everyone who's reaching out to you. Cancellation process. We touched on this briefly. It is outlined in the employee policy handbook as well. If you are canceling a session, call the office right away. The office will then inform your clinical supervisor as well as the family, and we will try to find a sub. If we are unable to find a sub, we will discuss rescheduling, having a makeup session. Late arrivals. If you are going to be more than 5 minutes late to a session, call or text the office. If you're going to be just a minute or two late, that's okay. There is a grace period. However, it is best if we contact the family and inform them of your tardiness rather than having them reach out to us wondering if their behavior therapist is going to arrive. So if you anticipate being late, call the office. Please do not text and drive. And we will then inform the parent of your estimated arrival time. If you arrive to a session and no one is home, wait a few minutes and then call the office. We will contact the parent and inquire about their estimated arrival time. And if we are unable to reach them and no one is home within 10 minutes of the scheduled session time, then you can leave. You will be paid for your drive time, and you will be reimbursed for mileage if it is a mileage reimbursement eligible case, meaning it is not your first and only session of the day. And you are also eligible for 1 hour of paid time if you accept an indirect work assignment. So if you arrive to a session and no one is there, we will offer you some kind of indirect work, and you can accept it or not accept it, and that's just our way of being able to cover some of that time for you. If, however, we do reach the parent and they inform us of their arrival time, then you will wait for their return and run the session at its originally scheduled time. For example, if you have a 4 to 6 session and the parent tells us they will be there at 4:30, but you are already at the home waiting, then you will do that session from 4:30 to 6, but you will be paid from 4 to 6, the original time. Illness policy. In order to keep both our staff and our clients as healthy as possible, we have an illness policy that outlines specific symptoms that would require cancellation. So if a client is exhibiting symptoms that are contagious, we do ask parents to cancel. If you arrive to a session and a client is displaying symptoms that are outlined in our policy, you do have the right to cancel that session. If this occurs, contact your supervisor or the office, and we will handle that for you. Additionally, if you are sick, we encourage self-care. When that does happen, let us know as soon as possible so we can make accommodations and cover that session. If you are going to be taking time off, please plan ahead and fill out our time off request form. We do encourage balance and taking the time that you need. However, it's important to recognize that we are providing a medically necessary treatment and we are contracted for a certain number of hours for our clients. And so while we support and encourage taking the time that you need, we do request that it is done in advance and we have the time to make accommodations and fulfill those hours with a sub. So discuss this with your supervisor, and the supervisor and the office will assist in finding a sub or arranging makeup hours, and we will provide you with a time off request form. Please read the scheduling protocol document that we provided you with. Some of the reasons for our scheduling protocol involve helping maintain those boundaries. So these policies allow the office to act as a buffer between staff and clients. It protects staff from unwanted scheduling requests. Having the office determine all scheduling changes ensures that the scheduler has current and accurate information. This is an essential part of the planning process when we are assigning behavior therapists to new cases. So there's a lot that goes on behind the scenes that many are not aware of. So there's multiple variables that we are considering when scheduling staff. So any kind of modification to the schedule should be done by the people who are aware of all of those variables. Also, having a single point of contact helps prevent therapists, supervisors, or managers from commuting to a scheduled session that's been changed without their knowledge. And having the office handle all scheduling matters ensures our billing practices remain accurate and ethical. This helps rendered sessions, sign-in sheets, session notes, and build time remain free of discrepancies. As well, since many behavior therapists conduct multiple sessions within a day. Having a trained scheduler arrange those schedules allows Hyperion to remain in compliance with California labor law requirements regarding rest breaks and meal breaks. So those are some of the reasons why we strongly encourage all staff to follow our scheduling policy. We are happy to answer any questions you may have after you read through the protocol document. Communication. So most of the policies that we've discussed so far involve relationships and communicating with those we work with our colleagues, and with the families that we work with. They are all in place to help everything flow the way it needs to flow. So it benefits all of us, including you, to adhere to these policies. It helps support professional boundaries, and it eases the administrative burden for the staff. Maintaining one point of contact for all administrative matters helps things flow as they should, and ultimately we will all benefit from that. So we very much appreciate you reading, understanding, and following all of the policies that we've discussed so far. Parent sign-in sheets, also known as PVRs, Parental Verification Receipt of Services. The clinical supervisor will add the PVRs to the program binder each month. It is your responsibility to sign in and out of each session. We'll review what these forms look like during our training. You'll sign your name, the session time, and that session start and end time should match the session start and end time on your timesheet. And it's the clinical supervisor's responsibility to gather those forms and turn them into the office each month. So behavior therapists will be responsible for signing them. These forms are part of our billing and are very important to be accurate for auditing purposes. So please ensure that you do sign in accurately for each session. Timesheets. Timesheets are due on the 1st and the 16th of each month. You are responsible to submit your timesheet on the due date. We will send out a courtesy email reminder. However, you are ultimately responsible to submit that on the due date, which helps us pay you on time. You are paid semi-monthly on the 10th and the 25th of each month through direct deposit. If our payday falls on the weekend, you're normally paid on Friday. If our payday falls on a holiday, you are normally paid on the last working day before the holiday. Timesheets are emailed to timesheet, singular, timesheet at hyperioncenter.com. And this is what your timesheet looks like. You will put your service, BT, behavior therapy, start time, end time, total time. This will all be filled out for you. You'll have your clients' names here. Each color is a new client. So this would be John Doe, Jane Doe, down here in gray. The total hours on the side are automated. So all you need to do is put in the time right here, and this will calculate automatically. Mileage. You are responsible to record your mileage. You will put your date, the client's name, location, and the total mileage. Holidays. Holidays are paid for full-time salaried staff. The office is closed and no services are provided on the following days: New Year's Day, President's Day, Memorial Day, Independence Day, Labor Day, Thanksgiving, the day after Thanksgiving, Christmas Eve and New Year's Eve. These numbers are in the employee handbook that we have given you. So for the behavior therapists or the clinical supervisors, the email is always the first letter of the first name and last name. So John Doe is jdoe@hyperioncenter.com. However, for the two co-founders and our biller and our administrative assistant, the email is our first name, Sharon@hyperioncenter.com. So all of this is outlined for you, and we also have admin@hyperioncenter.com, which is where you should address all of your administrative or scheduling inquiries. If you have a therapy question or concern, the person to call is the clinical supervisor overseeing the case, and you will have their phone number. It's also listed in the client's binder. If you are calling regarding a cancellation or a scheduling related matter or a timesheet related matter, you will call the office. If there's an unsolved therapy question or concern, you may reach out to the clinical director, Sharon Venezio. You can also reach out to the president, Ira Heilville. If there is any other concern or feedback or anything employment related, you can reach out to the clinical director. We encourage reaching out to us. We like to hear from our staff. So don't hesitate. We welcome all calls. What's next? So now that we've covered the policies and procedures and the administrative aspect of the onboarding process, we will move into our clinical training. So we will have clinical training that will be both online and in person. We'll discuss applied behavior analysis and everything therein. Data collection, session notes and documentation, how to run sessions. You will also have field training, which will involve overlaps where you are observing a behavior therapist run a session or your clinical supervisor run a session. And we will fade you in to your client sessions where you are running a session with your clinical supervisor observing and giving you feedback. If you have any questions regarding any of the content that we discussed today, please reach out, and we will see you at our clinical training.